We all know that caregivers play a critical role in our healthcare system, in our society, and in our families and our communities. And so today's event is about caregivers as partners in care, and that when we include caregivers as a part of that equation, we generate better outcomes, better experience, not only for patients or residents, but also for providers and caregivers.
So what if my brother didn't have an advocate constantly pushing for solutions with his respiratory doctor while he was in the ICU? And what if my mom didn't have an advocate for her to stay in the psychiatric ward to find the right treatment, given the history of deaths by suicide in our family?
I've heard people talking about seeing the caregiver as the thread that connects the system sector to sector. And our role, I think, as leaders in the health system is to focus on not breaking that thread. It's our opportunity to break down those silos, to support caregivers being the thread, bringing that information, and that improves transition. It makes the responsibility of a caregiver less stressful, hopefully, the responsibility of a care team less stressful, leading us to person-centered care, and that's the gift that caregivers bring to the system as a whole.
Being a family caregiver can be a lonely experience. It's not always recognized by the healthcare system, unfortunately, and a part of changing that is saying that, yeah, you know what, you're part of the team, and this is how we're going to support you as well as part of the team, because I notice family caregivers want to be involved, but also it's a lot.
I think the most important thing is they're an important part of the overall care experience, particularly for the family member or loved one that the caregiver's caring for, both in a medical standpoint and a psychosocial and just regular living, and having that emotional support and someone there to ensure that they have your best interests at heart.
I also worked with the Ontario Caregiver Organization to think about how can we create a caregiver ID badge, how can we have that badge recognized within a health system, how can we understand that this badge actually means something, it means something to security within the building, so these people are recognized as people who need to be there just like employees.
The Caregiver Support Initiative is another where resources were created that could be used at doctor's offices, for example, where it would have information that could be given to a caregiver for how to get support for themselves, trying to reduce caregiver burnout and increase access to other support tools that they may not be aware of.
Involving a diverse group of caregivers obviously helps us understand what the needs of the caregivers in East Toronto are, and we heard how they may be different from the needs of caregivers living in remote and rural communities. We're better able to develop resources and supports that meet those needs and are culturally appropriate, language specific.
Yeah, again, I think it's a big shout out to the OCO. I think that their guidance throughout our implementation for Caregiver ID has been invaluable. And, I think pulling us all together and having the difficult conversations, some of the scary things that we were coming up against at the beginning of implementation and just learning from others has been huge. So just a shout out to the Essential Care Partner Support Hub now, which is kind of a culmination of a lot of that early learning. If you are thinking about adopting an Essential Care Partner program, I would definitely highly recommend using that. Policies to help to guide your decisions and have that really well documented so you can ensure that there's a standardized approach as much as possible. Some of the learning modules and videos to help to build the culture has been huge as well.
To other people who might be thinking about what does our Essential Care Partner program look like, how could it evolve, how can we do more work cross-functionally or cross-sectorally, I think the most important thing we've seen today is if you bring all of the interested parties to the table, they will co-create a solution. That's what everybody has brought as examples, are those co-created solutions that were greater than the sum of the parts of the individual ideas. And so I think we see increasing evidence and reminders that people are hungry for that, they want to be a part of that, and they want to see that the efforts that we put into these things together turn into concrete outcomes that we can observe, that we can measure, and that really make a difference in people's lives, whether that's patients or residents or clients, caregivers or healthcare providers.
So as we think of the whole system of care and how family caregivers play a role in the ecosystem, we have to remember that we are the people who see the patient as a whole person. We're all in this together, so let's solve this together.